Okay, I'm gonna start you with some new instruments that you will not be tested on this week, but be prepared coming into 1178 next week. All right, so the first one we're going to talk about is a number 4 knife handle. You have learned the 3 and the 7 in last week. This is a number 4. If you look at the number 4, you notice how the hand grip here looks a little bit different than the 3 if you compare the two. Of course, on this one you can see the number 4 there, but for an instrument quiz that would be obviously covered up. Okay, so that's number 1. That is a number 4 knife handle, number 4 scalpel, number 4 handle, and we'll talk about loading blades in the coming module. All right, for number 2, this is a large Richardson. They come in small, medium, and large, just depending on how much you need to retract, how big of a size you would need. Sometimes you start small and they want to go bigger. Other times it's the opposite, but this is a Richardson. And this happens to be a large Richardson, okay? Then we have our Bonnie forceps. If you look at how the Bonnie forceps look right here, and they also have teeth. Bonnies are for grabbing different tissue, usually a heavier tissue because they grip pretty well. So that is a Bonnie forcep, okay? Then you have a Yankauer suction with a tip. Now on these, a lot of times this tip will come off. If it's bigger, it'll unscrew and come off, and you want to make sure. This one actually does not come off, but some of them do. You'll want to make sure that that tip is secure before using it. Now, a lot of times with the Yankauer suction, they come disposable. We don't usually have these as a reusable instrument, but they'll come disposable plastic with your suction tubing, and then they just go in the garbage after. So that is a Yankauer suction. Then we have Hemaclip appliers. Now these Hemaclip appliers, now I know we've been talking about passing instrumentation where they could get to the rings, but these Hemaclip appliers, once we use these in like vascular surgeries and things like that, there's a clip rack that goes on your back table and it actually sticks to it. You would stick these down into the clip and it comes off, and there's like a little, it almost looks like a little U type staple that goes there, and then they'll clip it and place it on the vessel or whatever. Now these Hemaclip appliers come in small, medium, and large. Now you will see some of them have different colored handles, but for testing purposes you would say small Hemaclip applier, large Hemaclip applier, or a medium. Large, medium, large, small, medium Hemaclip appliers. Okay. Number 6, we have a scissor. This is a new scissor. This is going to be for really thick tissue. You also see that it's curved. This is called a Jorgensen scissor. We use these a lot in GYN cases, OB, things like that. They'll use these because they are thick. They also are called gallbladder scissors, so sometimes they'll use them in general cases as well. Those are Jorgensen scissors, okay? For number 7, we've got a rake here. This rake is single-handed, just like this. It has very sharp points on it. We can use it for skin. We can use it in ortho. We can use it for pulling back knee tissue, hip tissue, or whatever. This is also called a Volkmann. So a Volkmann rake. Okay. Number 8, we've got an S retractor here. Pretty simple. Looks like an S. Used to retract back tissue in the abdomen if needed. Then we have a Goulet. Now notice we've had the Parker on the previous list that looks like a park bench. This is a Goulet. If you see it curves out a little bit right here, that's the difference between that and the Parker. This is a Goulet. Don't be confusing the two. Then we have an Eastman. Looks just like a Richardson. It's actually known in the book as a Richardson Eastman. I would take Richmond Eastman or just Eastman. It is a double-ended. See how one is large and one is small. to retract back various tissues for that. And then we've got our wheat laner. Wheat laner is a retractor, but this is considered a self-retaining retractor. So once I put it in the body, no matter how far I open it, it's gonna hold it open so I can see the tissue without you as the surgical technologist having to retract, or the surgeon or first assist having to retract. And this one's actually broken, but if you push this down, then it'll close back, and I also can't do it one-handed. Okay. Number 12, we have a baby Richardson. Just like the Richardson, it's just little. Used for smaller areas if we need to retract. Okay, that's number 12. Number 13, we have a bandage scissor. Now, yes, we call this a bandage scissor because we can use it to cut bandages and things like that we need for dressings. But sometimes they will also use these when they're cutting the perineum for an episiotomy in a vaginal birth. So those are bandage scissors or Lister bandage scissors. Okay, number 14, we've got a mosquito. You all know the hemostat. Well, a mosquito is just like a hemostat, made just like a hemostat, just tiny. It's just real small. This is a mosquito. They can come in curved and straight. Then we have a Fraser suction. Okay, they'll use this a lot in tonsils and things like that. So this is a Fraser suction. And then of instrumentation, we have a number 3 handle, but it's a long handle. So if you look at the serrations and the grooves of this 3 to this 4, you can see the difference. And the only difference in this 3 and the 3 you learned last week is this is for long. So if we needed to go deep into the body, we use this long one, okay? I've also added some supplies on here for you. These are laparotomy sponges or lap sponges. They have that radiopaque strip, and these come 5 to a pack. That can easily be a quiz question. How many laparotomies come in a pack? 5. Then we have your Ratex. They come in a pack of 10. Also something we use in the surgery to blot for blood and stuff like that. There's your radiopaque strip. These come in a pack of 10. Then we have Kittners or peanuts. They'll come just like this. They're sticky on the back side. You can stick them to your table if you'd like. And those would go on the end of a tonsil or a Kelly. I don't have one on the field, but I do have a mosquito to show you what it's like. You go in there just like this and pull it out. Okay. We have an asepto bulb syringe, a control syringe that we'd put a needle on if we wanted to control the amount of medication. And these are just standard syringes. They come in very different sizes, 3 cc's, 5 cc's, 10, 20, 30, up to 60. This is a hypodermic needle. Also comes in different sizes. This is an 18 gauge. We have 22, 16, all the gauges. And this is your Bovie. It comes in this Bovie pencil holder. It comes out. Now we have our scratch pad on here, and it has a Bovie tip in there, an unprotected one. Typically, sometimes they might want a different tip, so you'll just take that on. And finally, we have suction tubing. This goes on your suction tip to suction out any fluid, blood, or anything like that. So that's your list to study this week. I'll send it and post it.